Ambulance service. Is the patient breathing?
She's been unconscious for 45 seconds, been knocked over.
She's breathing, but she's got no feeling in her hands.
Just on the back of the cord. The cord stuck to me and he's holding the baby.
Starts in the morning, eh?
I know.
We're on board with the paramedics of West Midlands Ambulance Service.
This job changes every day.
Can we get fire or police, somebody with bolt cutters?
Painful even when I'm pressing here.
Saving lives and making a difference every day.
You say the patient's been stabbed?
In a medical emergency,
You all right?
6 million people rely on them.
You can go to people giving birth, then in their most traumatic time of their life.
You could be having a bleed on your brain.
OK, mate, move in.
Filming simultaneously with 7 paramedic crews.
It's got loads of things going on.
Take steady breath for me.
Capturing life on the front line.
There's no price you can put on saving somebody's life.
What do you think we'll get today, and think?
Oh, I don't know. As long as I get a cup of tea, I don't care.
It's 6:30 a.m. and for the paramedics of West Midlands Ambulance Service, it's wheels up.
Guess what's arrived last night?
What?
My prescription glasses.
Really? You have to let me see.
No, I don't.
Yeah?
I'm caught. They're not a vibe.
Why?
They look so bad.
No, get them out. Show
No.
me, please. Oh, they look so cute. No, they do. They look. Put them on.
No, they're going on when I need them, and I don't need them. Come on, let's book on.
As they head out on the road, these crews are facing their fears.
I went up Blackpool Tower and that's got a glass floor in it. I couldn't go on it.
You couldn't do
The
it.
kids were jumping on it and lying on it and everything.
For me, the one thing I probably couldn't do is a bungee jump.
I don't like clowns.
You don't like clowns?
Not at
Do you know
all.
what I'm going to dress up as Halloween then?
No.
Poo? I don't like getting poo on me.
Oh, don't bother me.
Or vom.
I've had worse.
If I was stuck on an island, 5 things I would take with me are... I'd take a lighter.
Yeah.
I'd take some string.
Yeah.
Because I could, like, wrap something in it and then try and fish with it. Mealworms to trap the fish. I'd take a knife and some water. Them are 5 good things.
So I'd have my pillow.
Yeah.
I'd take some ketchup.
Honestly, I've got no words. To be honest, I think I'm more likely to survive on a desert island than you.
What were your mealworms?
Well, definitely not with a pillow.
At least I'll be comfy.
Ambulance service. Is the patient breathing?
Yes,
Is the patient conscious?
she's been unconscious for 45 seconds, been knocked over, head damage.
A 7-year-old female that was knocked over by a dog in a field, walked back to the house and is now passed out under the carport on the drive. Lost consciousness twice. She has a large swelling on the back of her head. She's on blood thinners.
She's probably had a bleed.
For somebody to be taking blood thinners to then be unconscious due to a head injury, you are thinking there is a high possibility this patient has got a bleed on the brain. Just here. Here, this one. I'm Abby and we've got Emma as well.
Hi,
And what's your name, darling?
That's Jill. Jill.
And what was your name?
Paddy.
So, Paddy, were you there when it happened?
Yeah.
How have you ended up back on the floor here when you fell over in the field?
Walked back.
Yeah. And then, so why are you on the floor again?
They told them to lay me down.
And how long was she unconscious for before?
No.
45 seconds a minute each time.
While out walking her dogs, Jill got her legs tangled up in their leads and fell over, hitting her head. Husband Paddy is with her.
And do you remember what's happened? Are we bleeding? You're on blood thinners, aren't you? Okay, well, you've run yourself a trip to the hospital anyway, darling.
Just get me in, I'll be all right.
Jill, fortunately, you don't really have much choice. You're on blood thinners, you've got a big cut to your head, you've been unconscious twice. We need to go and get your head scanned.
I'm fine.
Jill's medication helps prevent the formation of blood clots, but a blow to the head could cause an internal bleed that won't stop.
After initially seeing Jill lying on the floor, it was very obvious she'd got quite a nasty cut to her head. She'd been unconscious, she was a bit confused, so we knew that she needed to go to hospital.
What a way to spend your 45th wedding anniversary.
Oh, still making it all about her.
Yeah.
Jill, we do need to go to hospital though, okay?
I'm fine.
If you go onto your back.
When somebody's telling me that they don't want to go to hospital, it does get quite frustrating. In Jill's case, she was very unwell and needed to go. Right, listen to me, Jill. Right, I want you to listen to me, okay? So what could be happening right now is you could be having a bleed on your brain, okay? So what I need you to do is I need you to come with us to hospital, okay? You need to have your head scanned, darling, because at the moment, this is not normal, okay?
But as Emma tries to persuade Jill, she passes out again.
She's gone. Is this what kept happening while you were waiting for her? Yeah.
It was your last meal. If you could pick a cake, what would it be?
But I'm quite boring. I do just quite like a normal Victoria sponge.
I like a Victoria sponge.
Or what would be your last cake meal?
Or carrot cake.
Oh no.
Yeah.
Well, at least I know you're not going to steal my carrot cake.
That's true. You brought me a slice in for work, didn't you, once?
I did.
And I took a bite and I was like,
Maybe not.
I was like, I don't want to.
So I had two slices.
Ambulance service, is the patient breathing? She was working for us and she's just having a fit or something. Apparently she's breathing, but she's got no feeling in her hands. She's been very sick.
So we have the category 1, unknown gender, unknown age, but they are currently sitting.
We're not far, are we? What if they're known epileptic before they've fallen and hit the head and had a seizure?
So when you see a Cat 1 call come out and it's a seizure, you're instantly thinking, well, time is brain. So the quicker you get there, the better the outcome sometimes. So it was really, really important that we got to this case really, really quickly.
Stay.
Fucking up! For fuck's sake!
In Evesham, paramedics Danny and Lisa are on their way to a patient having a seizure. It's a Category 1 emergency, meaning there's an immediate threat to life.
Stay.
Fucking up! For fuck's sake!
You can hear me. There's a speed camera there as well.
Take a breath.
Are you okay?
See, go ahead.
Apologies, you've just been involved in an RTC. No injuries, but unfortunately we have had to pull over. We have had contact with one other car. Yeah, blue lights, lots of sirens, and just coming up to a speed camera.
We're just going to somebody that's really poorly.
That's fine.
He's happy for us to go to the Cat 1 still. We're not sure that we can. It can be very dangerous driving on blue lights. More so, you're just always trying to preempt what the other road users are doing. You're always having to be on high alert of what other people are doing, as well as having control of the vehicle.
The driver of the other car has said that he's happy for us to proceed. We don't have any damage to our vehicle. There's damage to his vehicle.
Exchange all the details. I know there's no damage to the vehicle.
Thank you. We're just getting his details now.
As they talk to the driver, the emergency call gets passed to another crew.
Are you okay? Yeah, I'm fine.
Now Lisa and Danny are safe to return to work. They're reassigned the same Category 1 call.
I think that we can refocus ourselves quite quickly.
Putting that behind you. Right, let's move on and crack on.
Yeah. Same job. It's like we never even crashed.
Fever, vomiting. Patient does not remember what happened. No seizure, history.
We're gonna go get the bed.
That's it.
To the south of Dudley, paramedic Emma and technician Abby are treating Jill. She's fallen over, hitting her head, and keeps losing consciousness.
What does she suffer with? I'm guessing, has she got an irregular heartbeat?
AF.
Yeah. We're getting 121.75 at the moment, which is perfect.
On BP?
Yeah. What's she been getting?
Just today.
Oh, okay.
And that's a tested monitor.
It's been as low as 76
75,
over
50
50.
something.
She will probably pass out when we stand her.
Jill has a history of low blood pressure, which she monitors regularly. So there's a good chance she might pass out when she stands up.
No, I can do it, I can do it.
Don't do anything quickly. If you bend your legs up for us.
1, 2,
3.
Right, pop your bottom on the bed, darling.
Get some seat belts on you.
With Jill lapsing in and out of consciousness, Emma and Abby quickly move her to the ambulance.
Right. What's the temperature?
36
Can I have your arm, darling? Pop this in your... She's gone again. I'm going to get a line, you know.
Yeah.
Thank you.
No, I'm with it enough to know that that hurts.
Okay.
Bloody dogs, eh?
Emma inserts a cannula in Jill's arm so drugs can be given intravenously.
Pop this on your finger, darling.
Is this where you think? I wonder if I got clean underwear on.
It's okay. It's okay.
It's gone again. So how many times now?
Oof. I've lost count.
The fact that Jill became unconscious 10 plus times whilst we was on scene with her is very triggering, that there is something neurological going on, which would therefore mean that she would need to be seen urgently in hospital to have a brain scan.
How's she doing?
Right now, she does keep going in and out of consciousness. Jill? But we will just give the hospital a call to let them know that she's come in, so there can be people there waiting for her.
You started the day off with a blue light.
I've got cake to bake.
We've got steak to cook, but they might be waiting for a day or two.
When I heard it was Jill and Paddy's 45th wedding anniversary, I thought it was absolutely typical that something so bad has happened on this day, and I did genuinely feel really sorry for them.
Love you.
Yeah,
See you in a bit. She's yours.
Right, let's pass it on over to you. Patient has had a fall, hit head. A GCS is between 15 and 3. Yeah, she's got a hematoma to the back of her head. She's currently passed out with us about 10 plus times now.
I'm just going to start heading.
Yeah.
To keep Jill calm, Emma turns off the lights in the ambulance.
You know when you have these episodes where you go unconscious, can you hear what I'm saying throughout?
Yes.
Okay.
On blue lights, the 5-mile journey to Russell's Hall Hospital in Dudley takes just 11 minutes.
We're going straight into Risa.
Okay. But we're going into hospital now, okay?
As Emma is called ahead, the resus team will be ready and waiting to treat Jill.
Stated she was feeling unwell and faint. Patient then collapsed and appeared to be having a seizure.
To the south of Worcester in Evesham, paramedics Danny and Lisa are heading to a woman who's had a seizure.
Patient does not remember what happened. No seizure history.
After 6 minutes, they arrive at a garden centre where the patient works.
Hello. Is it Taylor? Hello. Hello, Taylor. My name's Lisa. This is Danny.
You okay?
Oh. So tell us a little bit about what's going on.
I was just feeling really dizzy and pretty warm.
Okay.
I came in here and sat down and
And then, so you were sat on this chair, and then what happened?
And she had her hands like this, and then next she threw herself back, and she was fitting.
When 19-year-old Taylor appeared to have a seizure, her manager Michelle called 999. Mum Lisa is here together with colleague Marie, who also saw what happened.
So at that point, was she responsive at all? No.
She was totally out, struggling to breathe.
So were we arms and legs going, or were we just shaking a little bit with hands?
Her hands and legs, just like...
So totally rigid?
Yeah.
Okay.
And then she went, as soon as she come round, puke.
Okay. Any medical history?
No. It's always really helpful if somebody has witnessed this seizure or this activity that's happened. They can tell you, have they hit their head? Has anything happened before the seizure? How long has it lasted? So it's really important to get as many details as you can. Do you mind if I just steal a bit of blood from your finger as well? Is that okay? Lovely. Right, let's just check your blood sugars. Just make sure they're all okay.
With no history of epilepsy, it's a bit of a medical mystery.
Should we do a blood pressure while we're stood first?
Sit and relax that arm down. How do you feel?
Does he at all?
No, I feel okay.
Okay, let's do these next few checks.
Okay. Just get the print off of your heart, okay? Some big T's on some of them, but nothing... It is always really concerning going to somebody that's had a loss of consciousness. You're thinking, has this ever happened before? Is this a new event? Have they got some sort of underlying medical condition? So it's really important to do a thorough assessment just to see what's happening.
Your blood pressure's very good, almost textbook. Oxygen levels are perfect, your heart rate's lovely. What was the BM?
4.5, I think it was.
Okay. First things first, I can't tell you what happened. It could be that you were having a seizure, but there's no obvious causes standing out to us as to why. It could be that actually we've had like a fainting episode and it's appeared like it is a seizure, and because our blood pressure has suddenly dropped, we've then vomited. That's the most obvious, I think. It is quite common to go to a patient and their symptoms resolved, which is great, but it is a little bit frustrating because obviously we have very little answers for that patient. Anybody though that's had a query seizure for the very first time, we'd always recommend go to hospital just because we don't know what's gone on. I'm happy if you want to take her to A&E and self-present, that's okay. Do you feel well enough to go with your mum?
Yeah, I feel completely fine.
We'll have a little walk out with you, make sure you're feeling okay.
Taylor will make her own way to hospital in the care of her mum, freeing up Danny and Lisa for their next emergency call.
It's difficult, isn't it? Has she had a seizure or has she fainted? Well, we don't know because we weren't there.
And hopefully she's not epileptic and it was just a collapsing episode.
Yeah.
One for sorrow, two for joy.
Hey! You superstitious?
A little bit.
If you walked under a ladder, you'd walk under the ladder and...
I know, probably nothing would happen. I just...
Paint would drop on your head.
You never know. A nail could drop on my head. The scaffolders could drop a hammer.
Might knock some sense into you. Do you put new shoes on the table?
No, my mum will kill me. No washing on New Year's Day because you wash a member of family away.
I've never heard that one before.
My mum's drilled it into my head so I'll never wash on New Year's Day.
Like a load of clothes washing?
Yeah, clothes washing. Yeah.
To be fair, New Year's Day is quite lazy because
Exactly.
you're most of the time hungover, so you wouldn't want to do any washing anyway.
Service is breathing. Right, okay. How many weeks pregnant were you, please?
I'm full term.
Okay, so dry the baby with a towel. Is that the baby crying in the background?
Yeah, we're both stuck in the splashing. Because the cord stuck to me and he's holding the baby.
You're doing ever so well. They're coming as fast as they can, I can assure you.
Oh?
5'9".
5'9", think you've sent to you it hasn't been coded yet, but it's a BBA, baby's been born. So you will be second on for you now. I'm sending another crew as well over.
I've never been to a fresh baby. Never held a baby in my life, have I?
You've never held a baby?
Never held a baby.
Early update required. Been having contractions for the past 2 days.
Bloody hell, go to it.
Feeling the urge to push.
Baby's
been born in the background.
I don't know why I feel anxious.
To see the work that the paramedics do, we're on board with 7 crews simultaneously as they respond to medical emergencies across the West Midlands.
I'm coming through, everybody.
In Walsall, paramedics Courtney and Parker are on blue lights heading to a woman who's just given birth.
I want to hold a baby. I need to practice.
Cord is still attached. Placenta has now been delivered.
I'm not
First time for everything.
I'm not quitting the cord. I don't have a lot of experience with newborns, with children. I've never actually held a proper baby, so it can be quite daunting to go into a situation where you're expected to be the person that knows everything and knows what to do.
Hello, all right.
Courtney and Parker are the second paramedic crew to arrive. With a mother and a newborn, there are now 2 patients to look after.
Is this baby proof? Hello, all right. This is baby proof.
Paramedics Mark and Lauren are keeping the baby boy warm in a towel while he's still connected by the umbilical cord to his mum.
Maybe initially crying, no complications during pregnancy or anything like that. We're going for no. Just getting baby dry, putting the nappy on, just going to get the hat on. You have to check mum yet. Mum's feeling a bit slightly woozy from there. Obviously, we've got a lack of room at the minute.
Mum, do you have any hats anywhere?
Go into the bedroom and then you'll see 2 bags.
2 bags in the bedroom.
When Gemma suddenly felt the urge to push, fortunately her partner Andrew was at home looking after their son Ralph.
Placenta's been delivered, yeah. Lovely.
Congratulations.
When we arrived and baby was crying, it was such a relief. Mum's done all the hard work, pushed the baby out. And to see Mum up and well, it was an amazing sight. Do you know what time he was born?
Midwives Sophie and Claire have also arrived to help take care of Gemma and her new baby boy.
It's a nice colour, isn't he?
Going to move her into the bedroom.
No worries. Are you a big brother? Is he the only one so far? Is this your second? Yeah.
Yeah, it was like the day before yesterday, it was really mild, and I carried on going to work, and then yesterday it was a bit like...
A bit dodgy.
A bit more extreme. Literally,
Hello.
I'm going to get to work, and I found him, I said, she's struggling.
No, it's... Yeah.
A bit half an hour later, she had give birth.
How far gone was she?
4 days late.
4 days late. 6?
Oh.
Even though Gemma appears remarkably unfazed by this rapid arrival, she still needs to be checked over.
Are we okay to do your blood pressure and stuff? Is that all right? Yeah.
So that's good. Pulse is good. Temps 37.1.
Oh, good.
From there, so yeah, all good. Do you want baby bringing in or waiting a couple of seconds?
Yeah, do you want baby?
Yeah.
Give him a cuddle. Your blood pressure's absolutely perfect, sweetheart, okay?
Just do it like that.
So I'll take it off so she can have a cuddle with the baby.
And then we'll have a...
I'll take this off so you can have a cuddle with the baby, all right?
Yeah, we'll get baby on you. Oh, yes. She's feeling a bit sick, but I think it's just the shock.
It's the adrenaline as well, isn't it?
Or else I'll start crying in a minute. It's such a lovely sight to see when baby gets first contact with mum. The emotions that run through you are just undescribable. It's such a lovely thing to see, and it's just seeing a family being brought together. Made me very emotional.
Hey, baby.
You know what wakes up tells people is here. I want to give birth in the bathroom. And we was on our own.
It's a story to tell, isn't it?
Oh, little baby.
Good for that.
Right, we'll clear some space and we'll get going, but congratulations.
Oh, it's lovely to meet you all.
Congratulations, big brother.
You're a big brother now, mate.
Great, mate.
I think Gemma was amazing. She did an amazing job. She was very brave and calm in that situation. Take care, both, all right.
As Gemma and her baby are well enough to stay at home, Courtney and Parker head off,
Congratulations.
Congrats. See you later.
leaving toddler Ralph to meet his new baby brother for the first time.
You're so gentle.
Nobody pokes out, does it?
You didn't get to have cuddles?
I honestly felt like I was going to start crying.
Tearing up. So that's your first baby?
First baby I've ever seen. Oh, God, I feel like I could cry.
Baby.
I was like, I'm going to go. This is it.
Baby.
Can't go in front of 2 paramedics, 2 midwives, and my best friend.
My best friend.
Oh, God. Tearing up.
When Gemma made her call for help, it was answered by the people here in the emergency control centre.
Have you got any other symptoms today, or is it just the bleeding that you're worried about today?
I'm staying right here with you until we get the ambulance there, OK?
The frontline nature of their job means it's long been considered one of the toughest roles in the ambulance service.
It can be difficult to switch off at the end of the day, especially if you've had a traumatic call that is somebody's life. It's hard to turn off from that.
Ambulance service, is the patient breathing?
Yeah.
Are you conscious and awake?
Hello, yeah, they're awake, but she's cut all her arms up. You need to send an ambulance. Blood everywhere.
You said that the bleeding's coming from her arms, is that right?
My immediate thought was how much blood is this patient losing, and how or what has the patient done to injure herself?
Yeah, she's slashed it.
She's cut her arms, okay. With the bleeding, has she been bleeding red blood very heavily within the last 2 hours, would you say?
Everywhere.
Hello? There's a lot of fucking blood. It's all over the kitchen floor. It's everywhere.
Is that blood spraying or spurting out?
It's spurting out a lot.
It's spurting out. Okay, we've got an ambulance all arranged. Is there any further information that the paramedics need to be aware of?
She would put a knife in you. She don't give a fuck.
It can be very scary knowing that paramedics have to go into cases like this where there could be a threat of violence.
Yeah, they need to come in.
Like I've explained to you, so we have... Listen.
Can you send the police out? No, yeah.
Yeah, obviously with her being aggressive, we will pass it to the police as well. Okay. With the cuts to the arm, are you aware if she's done this as a suicide attempt?
Yes.
She has, right, okay.
Suicide calls are unfortunately very common, and we get them on a daily basis. It's heartbreaking to know that so many people out there are struggling.
If possible, remove anything that she could use to further harm herself.
5 minutes later, paramedics did arrive to treat this patient.
In 500 yards, take second exit at roundabout.
It's so annoying, that sat nav. Yeah, it's like a form of torture listening to the sat nav because we were doing it off.
Just ahead, take second exit.
Drives you mad, doesn't it? I can't take it anymore. Who would you have as a sat-nav voice celebrity?
I don't know. What about yourself?
Alan Carr.
Really?
Turn left here. Turn right.
You're thinking of the wrong person, aren't you?
That's Alan Carr.
No, it's not.
It is.
No, it's not.
Who is it then?
Oh, maybe. Maybe it is. No,
Who would you have?
Bean. Mr. Bean.
Mr. Bean.
Yeah.
Turn left. Turn right.
Better than what's in the ambulances.
So, we've got a 87-year-old female, not much detail here, it just says unwitnessed fall last night, back pain. Doesn't say anybody's with them. No, really. No, say very limited detail.
In my mind, I'm thinking, how long has this person been on the floor? Are they still on the floor? How have they fallen? And that's of concern to us.
It's this one straight ahead, I think.
Hello, ambulance. Hello. Right, so when did you have a fall?
Last night.
Last night? Yeah. So what exactly happened then when you fell?
Get
your breath a bit.
We had dinner for 9 of us last night.
Oh, wow.
I don't know whether I tripped on the carpet or what happened, and I fell against the coffee table.
87-year-old Margaret injured herself last night. Her daughter-in-law Jackie is with her.
Here, where this...
Do you mind if I have a very quick look?
No.
Do you mind me some tucking you?
No, pull it up.
Oh, yeah.
You've got to look at it. I've got an artificial hip on that side, which they've had 3 goes out because I dislocated it once.
Yeah. Does it hurt you to breathe?
Well, only when I'm struggling to go to the loo and hide.
Yeah. Have you been struggling to go to the loo since this happening? Because that's a hell of a bruise. I'd argue whether you might have injured your kidney there.
Margaret wasn't complaining that much with the pain, but seeing the bruising, we're surprised that she was not complaining more.
Do you mind if I have a quick feel of your hips just down here? So I'm going to start quite high up. Obviously, that's where your bruising is, round here, isn't it? Yeah? So any pain down here?
No, that side is all right.
It's this
here.
Side, yeah, and into your groin a bit.
In here. I can't bear weight on it, really.
Yeah.
And I had a new knee on that side.
You can feel me touching your foot down here.
I'm 87.
You don't look it. No, you don't look it at all.
Go up.
Yeah, you're bionic. You're bionic.
About 95.
Margaret's generation are extremely stoic. In Margaret's case, she's fallen over 10 hours ago and gone to bed. You can't get more stoic than that. I think there's a high possibility that you've got what they call a pubic rami. I don't know whether you remember back at school looking at the pelvis. It looks like elephant ears. Basically, part of that is broken.
They didn't do that in my day.
Didn't they? Okay. Well, it's what
I wondered if there was something broken because of the severe pain.
So, if you were to give it a score out of 10, 10 being the worst pain ever, and 0 being nothing, where would you put it right now, sat there? Where would you put it on that scale?
Well, 9.5.
So pretty high. What we're going to do is we're going to try and get you some pain relief on board. Unfortunately, they haven't designed X-ray vision yet. Margaret needed an X-ray on her hip, but also because of the size of the bruise on her side there, she also might have needed some imaging of her kidney as well.
Is it going to make me sleepy? Or?
It'll make you feel like you've had a nice glass of wine.
Oh, will it?
Yeah.
Neil gives Margaret a painkiller known as gassing air, which she can inhale.
So pop it in your mouth, that's it. All right?
Who's here now?
Oh, that's another thing, it can change your voice a little bit.
Oh, yeah,
well, so you
you've got
might
a deep
start
voice now.
Talking like Kermit the Frog. How do you feel on it?
Fine.
Good.
Good. Fine, that's good.
Still in pain.
But you kind of laugh about it now.
They don't run over my toes as well.
No, he won't.
That's all I need.
With the gas and air taking effect, Neil and George prepare to take Margaret to hospital.
Okay.
Okay.
You're all right.
Have a little bit more.
Keep having a puff.
As we go through the doorways, we just don't want to catch your elbow.
Actually, the back door's easier because it's got...
Ah, now you tell us. Into the back. At least it's not raining, that's what you're going to think. Yeah. It's unusually warm weather.
Hang on.
So how's the pain feeling now?
Oh, not too bad, thank you.
Not too bad. Is this...
It's still there, but it's not as bad as it was.
Okay, is this sufficient at the moment?
Yeah.
Yeah, okay.
Let me know when you're ready, Neil.
Yeah, we're ready to go, mate. What did you do for work?
I was a teacher.
Oh, really? I could tell that, you know. That's why I asked the question.
How could you tell?
Well, just, I suppose, the authority.
After a 6-mile journey, Margaret arrives at Worcestershire Royal Hospital.
Stand clear. Ramp is in operation.
Right, okay.
Here, only X-rays will show what damage Margaret's coffee table has done to her hip.
Do you know what is the biggest organ on your body? Skin. Good answer.
I'm not silly, you know.
Did you know that your intestines can fill up a whole football pitch? Like, how on earth do I fit the whole of the outskirts of a football pitch in my stomach? I feel like I've heard that somewhere, unless it's the length around. I'm sure it's the length of a pool, around the pool. No, it depends on the
So we've
size
gone
of the
from a
pool.
swimming pool to a football pitch.
Or is that...
I think you're making it up.
Maybe.
They're long anyway.
Yeah, it's a very long. Squish it all in there. There's no way. Look, I know it all squidges all together, but how thin are they? It's got to get a big fat shit through it, do you know what I mean?
You mean it's got to get a poo through
You get a poo through it, yeah.
Not a big fat shit.
But it's true. I'd love to just pull my intestines out and just have a look.
Just have a look at it.
I'd be like, keep on going, keep going, keep going.
Ambulance services, the patient breathing?
Yes, he's had a little vomiting and feels very nauseous. He's been diagnosed with umbilical hernia. I mean, he's in agony now.
We are going to an 80-year-old male who went to the hospital yesterday and he was diagnosed with an umbilical hernia.
When part of the intestine pushes through the stomach wall, it's called an umbilical hernia and can be very painful.
Umbilical hernias can become life-threatening if they become strangulated, so therefore we had to get to this patient quickly.
On the outskirts of Walsall, paramedic Emma and technician Abby are responding to a 999 call.
Hello, what's your name?
John.
John, I'm Emma and this is Abby. So what's been going on then?
He's got the nausea and it's terrible pain.
Pop this on your arm.
So when did that start? Is it the pain in the stomach that's causing him today?
Yeah.
And that started today or
Yeah,
yesterday?
Well, it was yesterday.
Let's try this on another finger.
Yesterday, John went to hospital and was diagnosed with a hernia. But tonight, when the pain became unbearable, wife Norma called 999.
I had paracetamol that seemed to calm it down.
Okay.
And then they said, well, if it does come back, to get in touch with you.
Does look quite swollen, doesn't it, your stomach?
Yeah. It is distended. How much bigger would you say that it is today compared to yesterday?
A lot bigger.
A lot bigger. How has it changed since yesterday?
Got worse.
Is it like just in more intense pain?
Yeah.
Okay.
This type of hernia can lead to a painful blockage of the intestines.
This vomiting, have you actually been bringing anything up, like actively vomiting, or are you just heaving?
Just heaving.
Just heaving.
She's just feeling sick.
I'm not eating much though, I've hardly had anything to eat today.
Okay. Is it okay if I have a little listen to your tummy? Yeah.
Oh, yeah.
Abby checks John's abdomen to rule out any other causes of his severe stomach pain.
Your bowel sounds are present, they sound okay. I'm going to have a little feel, okay? That hurt just from touching it a little bit.
That's not too bad there.
When we were assessing John, you could tell that he was in quite a lot of pain, just from touching him in certain places on his abdomen. He was wincing. We call it guarding, when he tenses all of his stomach muscles. And no pain around your back?
He started to crawl around my back.
Okay. Shall we get you some paracetamol? We can give pain relief to patients that are in pain, which will obviously help, but also just giving some reassurance can go a long way.
He's making light of it, you see.
You can tell he's in pain.
Yeah.
It's the constant moving as well. He's trying to get himself comfortable in the seat.
Yeah.
Just fidgeting.
While they wait for the paracetamol to take effect, Emma and Abby find out more about John.
Have you had any recent coughs or colds or been unwell other than this stomach?
Absolutely fine. Fit as a butcher's dog, you know. Exercises, does his allotment.
What do you grow in your allotment?
Everything really, don't I?
Do you?
Broccoli and what have you. So
I love broccoli. I'm having loads of it at the minute. Yeah.
well grown.
It's in every single meal. So is the broccoli covered in anything? You know, you get a cauliflower and it's all covered around. Is the broccoli the same?
Yeah, it forms the head.
So you don't see any of that? You just see...
That's out of
Purple sprouting as well.
It's never a quiet moment with you, is there? I actually think you could talk the arse end off a donkey.
Probably right there. Yeah.
You are very chatty.
If I feel like there's a stage where there's no talk and I have to fill the gaps, so it's not awkward.
No awkward silence.
Yeah, I hate it. That's why I just come up with rubbish most of the time. What's that? That's not broccoli, is it? God, what big leaves for just a small... Look how big the leaves are for that, like, tiny little thing. We had a lot of laughs together, and also it was distraction from the pain that he was having. But I did think that broccoli grew on trees before meeting John, so every day is a school day. What would you like to do today? Would you like to come with us?
I can't carry on like this.
Yeah, that's fine.
Is that okay?
We can pop you up. You need that pain sorted.
What are you like on your feet? You going to be all right to walk out to the truck?
Yes.
Yeah. Can you just take a seat on there for me?
You can pop on here, darling.
With John and Norma safely on board and Emma's curiosity for broccoli satisfied, Abby can head for the hospital.
I feel like I've talked to both to death already. That's okay. I'll talk for the both of us.
After a 4-mile journey, Abby and Emma arrive at Walsall Manor Hospital.
Stand clear.
You okay?
In operation.
Yes, I am, thank you. Yeah.
His ears are bleeding.
I'm not surprised being stuck in the back of you.
Is there a brake on?
I just thought you weren't pushing.
No, there's a brake on.
In A&E, doctors will investigate why John's hernia has got so much worse tonight. After a CT scan and x-rays, it was decided John needed surgery. He was operated on the next morning to repair his hernia. Margaret, who collided with her coffee table, had fractured her pelvis and sustained 2 fractures to her hip. She spent 4 weeks in hospital. And Jill, who fell over while walking her dogs, spent 10 hours in A&E.
We were going out for our evening walk and we had got all the 4 dogs and the leads got wrapped around my leg as they all wanted to play with each other. Then I couldn't move my legs and then I over backwards and that's how I hit my head. And more than that, I don't really know. There were two lovely paramedics looking after me. Yeah, and they kept talking to me and saying, "No, come on, Jill, you've got to go to hospital." When I got to hospital, I was aware that they were taking me for a brain scan. When I got out, they did say that nothing had shown up, that yes, I had got a brain and it was all right. But I can't do my 45th wedding anniversary again. There's two very thick, very expensive steaks in the freezer. So we'll fish them out when, yes, when we can.
Next time, an 11-year-old rings 999 when his mum collapses.
Well done, bud.
I don't think I could have done that at 11.
I think all parents should teach their children to ring 999 in a medical emergency, because you never know when you're going to need it.
A 2-month-old baby is struggling to breathe.
She just went really funny, couldn't breathe, lips went blue.
A baby who is blue around the lips could indicate that they were not getting enough oxygen into their systems, and if that happens, it can be fatal.
And having had one heart attack, a man fears he's having another.
And what's the pain feel like?
It's like a sharp pain.
Sharp pain.
Dizziness, the sharp central chest pain, the sweatiness, they're all massive red flags for a heart attack.